that better?
Yeah.
This focus is slide down.
It need to be close to it, that's all.
Okay. So we'll just review some facts on the common causes of the lower back pain, the prevalence of lower back pain. All these facts are based on the numerous studies and researches done over the past few years. I'm just going to read them aloud here. Disorders of the lumbar spine or the lower back area are among the most common medical problems in Western countries, affecting up to 80% of the people at some point in their lives. 4 out of 5 adults will experience at least one episode of back pain at some time in their lives, and occurrences between the ages of 30 and 50 most commonly. Back problems appear with equal frequency in men and women. The cause of back pain, however, is not always apparent. So in about 85 to 90% of individuals, back pain cause cannot be identified. In Canada, the medical expenditures with respect to lower back pain is estimated to be between $6 to $12 billion annually. This includes the hospital admissions, the ambulance, the medical, the drugs, and the diagnostic tests like CT scan, MRI, and other tests required. Twice as many back injuries occur at home as compared to the workplace. It's a common notion that people who work in certain kind of occupations have more chances of back pain, which is true, but then a lot of times it happens just at home. About 400,000 people suffer disabling back injuries each year. Sooner or later, 8 out of 10 adults at some point in their lives will experience back pain that impairs activity. Impairs activity means it could be you'd be bound to bed rest, you'd have to stay off from work, and other activities of daily living. Roughly about 30 to 40% of all the workplace absences in Canada are due to back pain. In one of the studies conducted, it was found that about 70% of the people who have lower back pain only access their family doctors for it. They do not go beyond their family doctors to other healthcare professionals like physiotherapists and chiropractors. And one of the reasons for that is because physio and chiropractic is not available through a publicly funded system. So anybody who has health insurance or can actually access it, or if you pay out of your pocket. Let's review the anatomy of the spine a little bit for better understanding. Our spine, as you can see in this picture, is comprised of vertebrae, the bones. These are the bones that are stacked one over the other. These vertebrae join each other to form the joints, called as the facet joints. Then we have these discs in between the vertebrae that act as a shock absorber to the spine. Then we have muscles and ligaments that surround the whole spine. It's like a blanket to the spine. And then we have these nerves, as you can see, these yellow little nerves that come out of the little holes in the vertebrae. These nerves start from the spinal cord and they go to different parts of our body. There are 33 vertebrae or the bones that form our spine, starting from the neck to the tailbone. They provide support and protection for the spinal cord because the spinal cord passes in between the vertebrae. Then we have the discs in between the vertebrae. I'm sure most of you must be familiar with the discs. It's a very common word. A lot of people say we have disc herniations or disc protrusions. Now the discs are comprised of about 75% of water. So they're really soft. They're really soft and toothpaste-like material. It's like a gel. So it's really soft, and even like little injuries can sometimes cause disc herniations. Then we have the ligaments that connect one bone to another bone, and then we have the muscles again that move and support the joint, the pelvis and the spine. This is a picture of a normal spine. Just a term, body mechanics. Body mechanics is used for describing how we move our spine. So how we bend, how we twist, how we sit, how we stand. Then we have the normal curves. In a normal spine, we should have 4 curves: the cervical curve, thoracic curve, lumbar curve, and the sacral curve. So 2 anteriorly convex and 2 posteriorly convex curves. Then in a neutral spine, A neutral spine is described when all your soft tissues, your bones, are in a most comfortable and relaxed position. And also, if you look at this, our spine is actually divided into 4 areas. So we have the cervical or the neck region, we have thoracic or the mid-back region, the lumbar or the lower back region, and then we have the sacral or the lower back region. And then coccyx is the tailbone. Now, causes of lower back pain, it can have a wide variety of causes, so it's really difficult to name them all, but to classify them, we have some really simple classification here. Poor body mechanics. A lot of us, or most of us, don't really know what a good body mechanics is, how we're supposed to keep a good posture, how we're supposed to move our spine in the right way. Then we have trauma. Trauma could be sudden or repetitive. Sudden traumas could be something like a car accident, a fall, any kind of injuries, like a one-time injury. Or it could be a repetitive trauma. Repetitive trauma are usually, they happen at the workplace. It accumulates over the time, could be weeks, months, even years. We don't realize that we're accumulating that minor trauma. It's called micro traumas. We don't realize that until it's few months and years, and then we start noticing the lower back pain. Stressful living and working, loss of flexibility and strength. Now, loss of flexibility and strength can happen as a result of an injury, as a result of a repetitive trauma, or even some kind of a disease or disorder. Wear and tear, aging. With aging, there is a normal amount of wear and tear in all the parts of our body, and can happen in spine too. And then infections and tumors. Sometimes a little more red flagged conditions like infections and tumors can cause lower back pain. Then we have genetic and autoimmune disorders. There are some conditions, something like rheumatoid arthritis, ankylosing spondylitis. There are some conditions that are just genetically based. And poor diet. So if we're lacking nutrition in our diet, we're not taking enough calcium, we're not taking enough vitamins and minerals, that can also lead to weakness of the bones and joints, causing lower back pains. Heavy lifting. So if you're lifting a weight that is a bit beyond your capacity, that can cause lower back pain. Twisting at the waist while lifting or holding a heavy load. This is one of the most common problems. A lot of times, not just at work, at home, you're picking up a laundry basket and you twist at the same time. That can cause lower back pain. Reaching and lifting, most common for when you're working in the kitchen, you have something, you try to reach up to your counter to lift something, and suddenly you feel that lower back pain. Working in awkward, uncomfortable positions, so gardening, kneeling, any kind of activity that you do at home. Sitting or standing too long in one position. So very commonly we hear people say, oh, I was on a long drive or on a long flight and I have lower back pain. Standing, people who work 8 hours standing, same spot, it's common to have lower back pains. So some of the more common causes, as we discussed, car accidents, sports injuries, incorrect lifting, and repetitive strains. Why do injuries occur? So we've got physical factors, we've got the repetitive trauma, we've got high physical exertion. High physical exertion could be in youngsters, they go to the gym, maybe there's not proper guidance, no proper instructors, you're lifting heavy weights, that can cause lower back pains. Improper lifting and transferring techniques, which we will talk about later. And prolonged or awkward postures, and just the unexpected. You just never know. Excessive body weight. Obesity is one of the very common factors of having back problems. Poor physical fitness. So if you have a sedentary lifestyle, you're not a very active person, you do not exercise enough. And poor sleeping patterns. This is very common. A lot of times you would notice that when you went to bed at night, you were fine, but then when you wake up next morning, you have back pain. Blame it on your posture or blame it on your mattress, but it's the sleeping pattern. Signs and symptoms. Now, lower back pain itself is a symptom. There is a cause, there's a reason why we have lower back pain. The pain in the lower back, it could be a sharp, needle-like pain, it could be a dull, aching, muscular pain, It could be a stabbing pain or a burning pain. Sometimes these pains are constant. They're always there. They may fluctuate in intensity a little bit, but they're always there. Or they could be intermittent. So you may just feel it in the morning, but then as you warm up, you start to move around, it gets better. Or it could be positional. It's very common when we hear people say, I feel the pain when I'm sitting down, but as the moment I stand up and start to walk, my pain gets better. So sometimes they're only related to your position. Pain can be localized in the affected area or may radiate down into the legs, away from the affected area. Now this is very common. Sometimes you will feel the pain right in your lower back. It could be on one side, left or right, or it can be radiating down into the legs. When it radiates down into the leg, you sometimes just get confused because you think something's wrong with the legs. But it may be coming from the lower back, and the lower back may feel just fine. You feel no pain, nothing at all there. There are certain conditions where that can happen.
Sorry.
Muscle spasms. Muscle spasms is tightness of the muscles. It may or may not be present with the lower back pain. Stiffness, again, may or may not be present. Sometimes you feel locked into a position. So sometimes patients complain, oh, I just bent down to lift up a sock from the floor and I couldn't straighten up. Or I was just bending down, or I was sitting on my couch and I got up and I just could not straighten up. So you feel like you're locked in certain positions. Again, there is a reason behind it, and the reasons are the muscle stiffness, muscle guarding, spasms, or the soft tissue compromise in our lower back. At times, symptoms like weakness, numbness, and tingling may be noted in the buttock area or the lower extremities. So usually that involves some kind of nerve that causes radiating pain or numbness or tingling in the buttocks area or the lower extremities. Swelling may or may not be present. It's not a very common symptom, but sometimes people may notice that as well. Now, for a diagnosis, physiotherapist will generally conduct a detailed assessment, which includes history taking. History taking could be your social history, your medical history, your occupational history, your lifestyle, your level of activity. So there are numerous questions that the physiotherapist would ask you to assess the structures involved. They usually do a observation of your posture, observation of the lower back structures. Then you have some special tests. The special tests are done clinically. Right when you're in the clinic of the physiotherapist, they may do some tests to determine what could be wrong in the lower back area. Now, diagnosis of the lower back pain can generally be done clinically, but in most cases, well, not most cases, but in a lot of other cases, it may require some additional diagnosis. So to confirm the clinical diagnosis, patients may be referred for additional tests like X-rays, MRIs, and CT scans. X-rays normally tell us anything about the bones and the joints, but if there is something wrong with the soft tissues like muscles, nerves, ligaments, then the CT scans and MRI tests are more effective. Treatments. The treatment of the lower back pain is most commonly done in a conservative way. Conservative way means treating it non-surgically. So when somebody approaches their family doctor, it's usually prescribing medications like painkillers, muscle relaxants, and anti-inflammatory medications. Physiotherapy, using exercises and modalities, is another mode of treatment. Therapeutic massage helps in a lot of cases. And then just precautions. Rest is advised in some cases, depending on what's wrong, again. Monitoring the type and level of activity, it's very important. So what you're doing that you should not be doing to aggravate that pain, or stop some kind of an activity or limit it until your back pain recovers. Surgical approach is the last resort. This is done, again, it's completely the surgeon's decision. When the surgery can be done, a lot of factors are considered when somebody's considered for surgery. But this is mostly the last resort when the pain is severe, it's debilitating, it's just continuous, it's there for long periods of time, severe enough to affect your routine, your daily living, your job, just you as a person. So that's when surgeries are generally considered. Prevention. So as we all know, prevention is the best cure, best medicine. So there's a lot that you can do to help yourself. So learning about proper body mechanics, proper lifting techniques, correct posture, and exercising on a daily basis could help prevent lower back pain in a lot of cases. Now, talking about body mechanics, if you have a choice to push or pull, what would you choose? Good. We prefer to push. The reason is when we pull something, we're actually using the muscles of our arm and our lower back, which are not that strong in a lot of people. When we push, we use the muscles of our abdomen and we use the muscles of our thighs, which are one of the most strongest muscles of our body. General rule, keep the load close to your body. So if you're holding on to something, you're holding on to the grocery bags, laundry basket, anything heavy, keep it close to your body, not your arms extended too far. Use abdominal bracing, which means whenever you have something heavy in your hands, your abdomen, your stomach muscles should be tight. Just tighten them. But that does not mean you don't breathe. Make sure that you don't stop breathing. Pivot with feet. Avoid twisting. Again, a very common practice, especially when you're in a rush, you've got lots to do. You lift up something, and when you have to place it on another surface, like a table or kitchen counter, we would just go like that. Instead of twisting your body with something in your hands, it's better to take small steps and pivot your whole body. So instead of going like that, you go like this. I know it's easier said than done, but just a little practice would work. 5 L's of lifting. So always test the weight of the load before lifting. So anytime you attempt to lift something up, you should have an idea of how heavy it is. Prior to lifting, take a deep breath in, but do not hold it. The moment you lift something up, you exhale. Lever, keep the load close to your body. Always use your legs and not your back while lifting. And maintain the curve in your back when you lift something. So we have this hollow in our lower back, always maintain. I'm just going to demonstrate the right way of lifting something off the floor, okay? So if you've got something here, bend down, lift something up, you keep it close, you take few steps and bend down and put it back. So the idea is that you use your legs more than you use your back. This is a very common posture that we use, or very common position that we use to lift something up. So never do that. Always bend your legs. So always bend your legs here. As you see, the lumbar spine is flattened in this person. So we should have that curve maintained. And, well, we can't see, but there cannot be any abdominal bracing in this position, which is very important to lift something up. Now, a good posture. Most of us debate on a good posture. Everybody thinks we have the best posture, but do we really know what is the definition of a good posture? So a good posture is defined when you imagine a line going through your earlobes, through the tip of your shoulder, passing through your hip joint, passing down to the lateral ankle. So from the earlobe, passing through the shoulder, through your hip joint, going all the way down to the side of your ankle. That's when we say somebody has a good posture. And unfortunately, most of us don't have a good posture. The way we describe it as your chin should be tucked in, your shoulders should be back, and your chest should be lifted out and up. Most of us have a forward protruded chin, so we're like that, shoulders rounded, and our chest is always down. We have exactly the opposite posture as what we should normally have. And it takes some exercise and some awareness to have this kind of a posture. Sitting posture, again, when you have, for people especially who work in offices where they're sitting at a desk looking at the computer for long extended periods of time, that's how it should look like. The computer should always be at the level of the eyes. Your neck should be straight, your spine should be straight, your hips should be bent at about 90 degrees angle. So they should be parallel to the floor, and then your knees should be bent to 90 degrees angle, like that. This is when we say we have a good posture. If required, people can always put like a little cushion or a pillow, in the back of their lower back to maintain that position. Sleeping postures. Now, whenever, some people are used to sleeping on their sides, some people are used to sleeping on their backs. If you're one of those who sleep mostly on their side, it's good to have a pillow in between your legs here. If you're used to sleeping on your back, face up, it's good to have a pillow below your knees. This takes off a lot of pressure from your lower back area. If you're used to sleeping on your stomach, there is just no way of maintaining a good posture. This is just not a good position to sleep in. So I know it's hard to say because you're sleeping, you don't know how you're sleeping, but avoid sleeping on your stomach, especially for too long, if you can. When you're sleeping on your stomach, your neck can never be in the neutral position. It will always be turned to one side. And when it's turned on one side for long periods of time, you're bound to have neck pains. And the last is exercises. Exercises that work your back, your hips, your thighs, and abdominal muscles can minimize the back problems. Learn how to exercise and make it a part of your daily routine. It may take a little effort in the beginning because you're not used to it, but as you keep doing it on a daily basis, it will just become automatic. Engage in cross-training programs, which could be a mix of running, jogging, cycling, swimming, those kind of exercises. Then you maintain a strong and conditioned abdomen or abdominal muscles or stomach muscles. Physiotherapists can advise you on the intensity, duration, and frequency of exercises upon consultation. There is a huge variety of exercises available, but not everything is for everybody. Some exercises can actually harm you more than they will benefit you. So I would always suggest or strongly recommend that you always seek advice whenever you are trying to adapt to some kind of an exercise program or an exercise routine, and especially if you have a pre-existing condition. So if there is something already going on in your mid-back, your lower back, or your neck, please make sure that you have proper instructions and guidance before you start with any exercise. These three are some very common postural exercises. Again, these are for people who do not have any known back problems. But if you do, then I would suggest again that you ask your physiotherapist before you do them. These are for posture. So the first one is called chin tucks. So you keep 2 fingers on your chin and you tuck your chin in. So it goes like that. You're not pushing it up, you're not bringing it down, you're bringing it straight back like that. So you make a double chin. That's chin tucks because, as I said, most of us have a chin forward posture. So to put it back. This exercise strengthens the muscles at the back of your neck and they hold your neck back. The second one is called shoulder retractions, and this is for the mid-back area. For the mid-back, you can, again, all you have to do is bring your shoulder blades back. You can hold your arms together if you'd like for more convenience, and then just bring your shoulder blades back together. And the third one is for the lower back area, where you bend backwards a little bit, just a little bit, as you can see, with your hands on your lower back area. So these exercises, again, are for people who do not have any known problems of the lower back for now, but these are relatively safe exercises, especially the last one, because if you look at your movements, your daily routine, there's not even a single activity that you can think of that involves backward bending. Everything that you do in your daily routine involves forward bending. Whether you're sitting, whether you're bending down, whether you're walking is a neutral position, but there's nothing that you do that involves backward bending. So it's very important to bend our back backwards as a part of the exercise program. So that brings us to the end of the presentation. I thank you all for